Hello class, what I'd like to do for you today is just go over some of the contents and materials that you would have discussed in your lab today. Obviously there was no class or lab time today because of the Martin Luther King holiday. This is Dr. O'Shaughnessy, and I'm just kind of giving a summary of some of the important information that you would have participated in today with your lab instructor. As you know from your weekly lesson plan, we're starting Nursing 100 out with kind of going over the concepts and kind of letting you know how this whole concept-based curriculum is kind of taught throughout our whole curriculum. And it's very important to know too that we're also starting with healthcare delivery, because as nurses you are the biggest influence in your patient's health as the registered nurse. And things have changed quite a bit when we look at the health of our patients. You know, many years ago, 20, 30, 40 years ago in the healthcare arena, we just saw patients when they were sick. Those are the types of patients that would come through the ER. Those were the patients that would make appointments with their physicians. But now we're kind of changing that whole paradigm of healthcare delivery. We really want to teach people how to stay healthy and how to teach them to avoid acquiring very serious illnesses, or even illnesses that, you know, are really tough to go through. And an example of that would be we really promote flu vaccines. We are now in the flu season, and we hope that people out there are getting their flu vaccines to prevent them from getting the flu. That is a way in which we promote health. We also teach people about their lifestyle, not smoking, keeping their weight under control. What does their diet consist of? Exercising, keeping their stress level down. All those are risk factors for acquiring cardiovascular disease. So I think you kind of get the picture that really what we're trying to do is prevent the problem from occurring. This is better for the patient, and it's also a much more economical approach to maintaining good health, because without the disease there's no expense associated with it, just the checkup made by the nurse practitioner or the healthcare provider. As you look at this lab form, what I would hope that you would do is to look at the table on page 440, and it's a really nice table that provides a recommended health promotion activities for adults. And as you can see, it's kind of split up into young adults, middle-aged adults, and older adults, and what they should be doing at their particular age. And you know, good health starts early. Having routine physical examinations, immunizations, certain situations or diseases can occur in even young women, especially their gynecological health, looking at people at any age to screen for diabetes. If they smoke, we can offer smoking cessation programs as well as counseling. And then you can see as people begin to age, we start screening for middle-aged adults for a lot of the cardiovascular diseases, especially monitoring things like blood pressure, doing a baseline EKG, looking for possible cancers like screening for colon cancer, doing sigmoidoscopies and colonoscopies. And as people begin to get into that geriatric age or the older adult, you can see that there's a lot of things that we might do for those patients as well. But I really like you to take a look at that, because it's really great advice and good teaching to give to our patients. And then on the table 7.1, which talks about the 12 types of health indicators in Healthy People 2020. Healthy People 2020 is a government-funded part of our government that really looks at all the diseases that occur over a 10-year period. Where are most of the problems at? Does it involve children? Does it involve young adults? What is the prevalent type of disease that we see across the country? So this is what Healthy People 2020 do. And we look at that, and they bring out that information and those statistics to the American people to let them know where we're facing the most problems in healthcare and in disease processes and things like that. And we look at 3 dimensions: the biological dimension, the psychological dimension, and the cognitive dimension. And when we talk about the biological dimension, that refers to topics such as genetics, anatomy and physiology, the autonomic nervous system, the central nervous system, and some of the biochemical processes. And then we look at the psychological dimension, which refers to many of the social skills that we see with our patients, even just their mental health and things like social acceptance. And then we, of course, look at the cognitive dimension, which is referred to as those thinking processes, the knowledge, the whats and the whys. And we as nurses, especially registered nurses, really need to know the whys. That's why it's so important that we understand our patient's particular pathophysiology, because that helps us understand the whys, why we do the interventions we do, why we give the medications we do, why the healthcare provider may order certain diagnostic testing, and then how we interpret that testing. That helps us answer the whys in regards to our patient's health. And when we talk about the word health, all it basically means, according to your book, is the presence or the absence of disease, okay? And we look at wellness, and that's what we're hoping we see with our patients. That's that state of well-being. And well-being is one of the components of health. And we know that many of our people out in our community really do have barriers that exist, which kind of is the reason why maybe they don't have such good health. Maybe because they smoke a lot. That's why they get 2 or 3 respiratory infections a year. Maybe their diet is very high in cholesterol and fats, and that's why they're overweight. So, and sometimes it's not that these things are done purposefully. Sometimes it's the reason that is about no knowledge and no understanding, and really have never been taught that, hey, these are all risk factors that will lead to that particular disease. So look at some of these questions here on this first lab form. What barriers exist to successful implementation of a change to improve your health? And maybe you yourself might ask yourself the same question. You know, you are now entering into nursing school, and it's a very rigorous program. It will demand a lot of your time, and sometimes because you're so focused on school, you kind of neglect yourself. And we don't want that to happen, because when you start getting less sleep and you don't eat as well as you used to, and your stress level goes a little bit higher, then your immune system suffers, and this is why many of the students then begin to get sick. So we're trying to definitely, not only with our patients, but also educate you as to what can I do to stay healthy, because when you start missing class and you start missing clinicals, you feel like you're getting behind. And remember, Nursing 100 is only a 7-week course. Our 8th week is the final exam. So there are barriers out there that really do affect someone from, having good health. Okay. And then, you might want to think about what advice would you offer a patient who asks how to make a change to improve their health. And I think as nurses, we need to not be judgmental. We need to be kind and empathetic, and really just kind of make small changes, because sometimes people, that's the only thing that they can do at the moment. Too drastic of changes and too many changes may stress someone out, and it may be very difficult to do, because sometimes those changes you make may affect other people in your life, particularly your families and your husband and your children or whatever. So those are the kind of things that you might want to offer to your patient. But the most important thing is to kind of know more about your patient. Looking at their health history, what do you see in here that maybe you could offer some type of advice? What do they have access to as far as where do they live in the community? What's their occupation? What's their age? So those things would all be taken into consideration as to what kind of advice that you would give that particular person, depending on all those different variables. And then you want to think about what is the difference between modifiable and non-modifiable variables for health. And when you look at that, we do have modifiable, which means that we can change. And those are some of the things like exercising, the diets that we eat, going to see your physician once a year, not smoking, watching how much alcohol you drink, not abusing drugs, trying to take care of your mental health as well as your physical health. Now, those non-modifiable variables are things like your age, your genetics. Those things we cannot change. So that's the difference between those two. So you want to think about what kind of things that particular person can change about themselves. If they have a parent that really acquired heart disease or high blood pressure at a very young age, that's in their genetics. That's part of that biophysical dimension. And they can't really change those genetics, but they can really be very attentive to making sure that they eat healthy, they don't gain a lot of weight, and that their blood pressure or whatever will not be affected as well. We also look at illness behaviors. And when we talk about illness behaviors, those can be either positive or negative. Those are ways that individuals describe, monitor, and interpret their symptoms and take remedial action. And what we would mean by that, or an example of that, would be a patient eating a family recipe for chicken soup when flu symptoms start. Or we would see someone staying in bed for an extended rest and not doing housework, or going to a job, or attending school. And how patients behave when they are ill is highly individualized. It is affected by many variables such as their age, their sex, their occupation, their socioeconomic status, religion, ethnic origin, psychological stability and personality, their education, and their modes of coping. So that's what we mean by illness behaviors. And as you can see down here, I have the indicators from Healthy People 2020. And these are the 12 types of indicators, health indicators in Healthy People 2020. And as you can see, access to health services, clinical prevention services, environmental quality, injury and violence, maternal, infant, and child health, mental health, nutrition, reproductive health, social determinants, substance abuse, and tobacco abuse. This chart is actually on page 437 in your volume 1, so it would be good to review that, okay? And it really gives some great statistic on these particular indicators, okay? Another thing that we're going to be talking about is along with healthcare, which is really important, is culture. All right. You as the nurse will be taking care of many, many, many types of patients in your lifetime. And you will take care of many patients who are not from our area, who may be from another country. And it's important to be very respectful of that, to be very sensitive to that. And what we do as nurses is we develop what we call cultural competence, okay? And what is the definition of cultural competence? I want you to think about that. And the definition of cultural competence is on page 1776 in your volume 2 Pearson Concepts book. And cultural competence is the ability to apply the knowledge and skills needed to provide high-quality, evidence-based care to patients of diverse backgrounds and beliefs, to overcome barriers and access resources, promoting health and wellness. And it goes on to talk about how cultural competence has some basic characteristics. Okay? So you can go over that and read. And what I have up here is just an example of possibly a patient that you may care for. Mr. Al-Kibi, he's a 54-year-old Somalian Muslim immigrant. He's being seen as an outpatient in the outpatient clinic for follow-up care related to his diabetes. He works in maintenance at a local hospital during the day and also has a part-time job selling used goods at an auction in the evening, and he takes an oral hypoglycemic med, and that's just a med to help keep his blood sugar down, and that med is called metformin. You'll get those meds later on when you take your pharmacology courses. So the first question you might want to think about is, what do you need to know to effectively speak with this patient on his health management? Okay, and those are some things that you may want to think about. How much knowledge do you know about this particular culture, the Somalian Muslim culture? Does he speak English? Remember, many cultures, their terms may not mean the same thing as our terms here in this country. And so those are things that is very important to know, because communication is everything. And you want to know how much he understands about his disease of diabetes, and how much he understands about the medications that he's taking. Sometimes these people do not want to know a lot. They just say, give me the medication and I will take it as prescribed by my physician, and really don't want to understand that. But then there's other people that really do want to, be totally involved in the care of themselves and to be able to manage their disease processes. He does work in maintenance at a hospital, and he also has another part-time job. He's not very old, he's only 54. So those are things that you may want to think about. The second question asks, how can the nurse effectively incorporate cultural competence into the discussion on health management? I think it's important that we respect his regards to his disease and let him be in charge. And also, like I said before, find out how much he knows about his disease, and that we're both on the same page as far as the understanding. And I would also want to know what if he's having any problems. And with diabetes, it's a very complex disease that involves a lot of self-care, self-testing, interpretation. So we would want to see why he is here that day, and are there any health issues going on as to why he wants to be seen in the outpatient clinic. Maybe his blood sugars have been really high and this medication is not really keeping his blood sugar in control. So those are some of the things that we may want to think about. Okay? And then as we continue to move down this sheet, I wanted you to read this particular case study. I think it's very important. And here it is: an Arab couple has come to a local clinical, because the wife, who is 6 months pregnant, is not feeling well. The husband speaks English fluently, but the wife's proficiency in English is more limited. Both are dressed in American-style clothes. During the assessment, the registered nurse, Clea Smith, determines that the couple has a 9-month-old and a 2-year-old at home. Ms. Smith also learns that the husband is the head of the household, making most of the major decisions for the family, and that the wife has sole responsibility for the family's care and daily living needs. The wife presents with exhaustion and elevated blood pressure, and after obtaining a urine specimen, the physician diagnoses toxemia and orders the wife to be on strict bed rest and to return in 2 weeks. While the husband conveys concern for his wife's health, he is reluctant to have her treatment disrupt the household routine. So here we have a little scenario that kind of represents how this particular household is run in this particular culture. And we can kind of go up here and see what kind of thoughts would we have about this. And I think probably our first reaction to this is, oh my gosh, is he going to allow his wife to, fulfill the orders that were given by the doctor? So what are the priorities of care for the wife? Obviously, her health and the health of the baby is of top priority, and she's to be on bed rest because she has toxemia. But, the husband doesn't see it that way. He feels that it's her obligation to take care of the family because he's doing his part in, maintaining the family and probably the financial end of it. We might think right away, oh my God, this guy, he has no feelings, he's not caring. But you have to understand, this is how it is run in this particular culture, okay? This is how, this is where the roles of the husband and wife lie in the Arab culture. And then the second question is, what additional information would you like to collect about this family? And as I read this, and I hope that you're thinking about some answers, is there an extended family? Is there grandparents that can come and stay with the family while the wife is trying to maintain good health until she delivers the baby? So these are things that you might want to think about in regards, and not to go first at hand and judge this husband as somebody cruel and insensitive to what his wife needs. We can't do that. These are cultures, and this is how this culture is kind of manifested within that particular family. Using either the AST or the LEARN model, describe how the nurse working with this family could understand and address the situation and the physician's recommendations with both the husband and wife. And as you can see, these are two acronyms that kind of help us to determine what's the plan. Awareness, skill, knowledge, encounters, and desire. And with the LEARN, it's listen to the patient's perception of the problem, explain your perception, acknowledge and discuss the differences, and review the treatments, and negotiate agreement. So this is how we could hopefully work this out, in which the wife and the baby stay safe, the 2 children are being cared for, the husband is happy, and that all the other needs of the family are being met. So something to think about, but that's a great example. And these are the kind of things that you're going to run into when you take care of patients from different cultures. All right, here's another situation as well. Okay. Henry Lee is approximately 55 years old. He's born in China. He's been living in the United States for the last 10 years, working as a professor at a local university. Following surgery for a broken arm, he refuses pain medication, explaining that his discomfort is bearable and he can survive without medication. When you next check on him, you find him restless and uncomfortable, and you have a standing order to administer medication as needed, and again offer to administer medication. Mr. Lee again refuses, saying that your other responsibilities are more important than his discomfort, and he does not want to impose. So here we do again have a very educated and highly intelligent patient who is only 55 years old. He is a professor, and maybe within his culture he feels it's weak to take pain medications. So this may be what is behind his refusal. Is there anything you as the nurse can say to change his mind? Because we know the effects of pain physiologically on the body, and what additional information might influence your nursing care. Again, we could use those two models and kind of come to some compromise with this patient. But as nurses, we want to provide comfort to our patients, and this is very disturbing to us to see a patient suffer when we know we can give him medications. Maybe he's worried about addiction. Maybe if he accepts that, it shows signs of weakness. There's all kinds of reasons within this Chinese culture as to why he's refusing pain medication. I asked you also to look at the article that is in your Canvas course, and it's Is Cultural Competency Required in Today's Nursing Care? And I'd hope that you would read that. It's by Shanta Collins. I'm not going to go over the article. I would hope that you would do that on your own, and then please take time to look at these questions. You may see a question from that article on your test. So I just want to make sure that you're aware of that. It's a very, very good article, and these questions are very good. And it also gives you a good idea of what content was in that article. Okay? So please take the time to go over that. Okay? All right, moving along. What I'd like you to also do is, you can see up here, you have a copy of the cultural competency quiz, and as you can see, there's 10 questions, and you can go on the website. Now, normally if we were in the lab, we would go over these answers, and I'd be happy to post those for you and after you take the quiz, so that you can kind of see how you did. Now, there's no grade to this, but it just shows you, am I culturally competent, or do I have some work to do in that regards? So please take the time to go over these questions. As you can see, and I'm just kind of moving this around so you can kind of see. But this cultural competency quiz is in your packet. And I'm just moving this around so you can kind of see it. And maybe some of you have it. You can see there's 10 questions, okay? So please take the time to do that. All right? All right. All right. And as I'd like to just tell you too that as you go through these lab forms and kind of correlate some of the reading with the content from the lab, if you have any questions or anything, feel free to ask me, or you can ask your lab instructor on Wednesday when you return to class. Okay? All right. We have here too that obviously within our society, there's unfortunately what we call cultural biases, okay? And I think it's first important to think about exactly what is bias. And the definition is on page 770 in your concepts book. And bias is just simply the favoring a group or individual over another, all right? And we know that gender bias results in sexism and occurs when male values, beliefs, or activities are preferred over female. And within bias, we do have gender bias, we do have race bias, we do have class bias, we do have sexual differences, disability status, and age. Those are all the different types of biases that we may see. And here's this riddle that I put here on your form. A young boy and his father are involved in a car accident. The father dies at the scene. The boy is transported to the hospital, taken immediately into surgery. But the surgeon steps out of the operating room and says, "I can't operate on this boy. He is my son. Who is the surgeon?" So I'm not going to tell you the answer. Some of you may be able to figure it out. But you might want to discuss this with your lab instructor on Wednesday. I I thought that was kind of interesting. It took me a while to think about it, and then I kind of figured it out. So discuss that with yourself or your lab partner, and relate. See how this riddle relates to our discussion on bias. And also recognize your personal factors related to diversity and bias. What factors in your past experience might predispose you to be biased in a healthcare situation? Are there things that happened within your life on a personal level that may influence you as a nurse in regards to caring for your patient? And provide one example which might create conflict in you. So something to think about, okay? So as we move on, you can see right here, you also have this in your packet, which is the heritage assessment. Just go over the questions. You don't have to do this because obviously we didn't have lab today, but this is about looking at your heritage background, okay? And you would have done this assessment on your lab partner. So let's scroll and go through that. And it just gives you a little bit more awareness, and you learn more about your patient in that regards too. It talks about ethnic background, religious backgrounds, you know, things like that, about your language, and I think it's very good. Another thing that we brought forth to discuss, and these are things now that we're able to discuss out in the open, is as we talk about bias, the lesbian, gay, bisexual, and transgender health. And I've put this article into your packet because I think it's something that we have to be aware of. You are going to care for patients that have different sexual backgrounds, and I think it's important that you kind of look at yourself and say to yourself, is this going to be okay with me, okay? Because the LGBT health is extremely important, all right? I want you to read this article. It's very, very good, and for some of you it may be difficult, for others you have no problem. Because what we want to do is, just like every other patient we care for, we want to improve the health, the safety, and the well-being of our patients who are lesbian, gays, bisexual, or transgender. And we know that the LGBT individuals encompass all races and ethnicities, religions, and social classes, as sexual orientation and gender identity questions are not asked on most national or state surveys, making it difficult to estimate the number of LGBT individuals and their health needs. But I think there's some really great information on here that I was not even aware of, and of course this was not even discussed when I was in nursing school. But it's important to look at some of the data and understand the LGBT health. And some of these things were just quite disturbing when we look at some of the social determinants that affect the health of the LGBT individuals, that relate to oppression and discrimination, and these are the examples that they provide. And I think some of these data and statistics were quite alarming, where LGBT youth are 2 to 3 times more likely to attempt suicide. So please look over this article. So I think it was really, really good. Just give us a little bit more awareness that we will be taking care of these patients, and we have to look at ourselves and say, hey, is that going to affect the way I care for that patient, okay? And these are continuing issues that we see within the LGBT health, they exist, and they're human, and they deserve the same kind of care that all the other patients that we care for are getting. All right, so I want that to be brought to your attention. Other than that, I think that sums up a lot of the things that I want you to definitely look at, okay? And I really want you to really pay close attention to your assigned chapters on culture and diversity, because there's a lot of terms that I want you to be familiar with that we're going to talk about in class. Things like cultural humility, what else? Cultural values. This is huge because, as I said before, you're going to be caring for a lot of patients that are not from our communities, that really do practice within their culture. And this is definitely conveyed through their beliefs in health and wellness and disease and living and dying. So it's something that we have to be aware of. This pretty much concludes just a short little lecture on what you would have gone over had you been in class today. So if there's any further questions, let me know. But the important thing is to review these activities and exercises and make sure that you've done your reading for today. And then you'll resume your lab class on Wednesday. And like I said, if there's any questions, you could ask your lab instructor or myself. I'd be glad to answer this in any way I can. Have a great day, and stay safe, and we'll see you all on Wednesday. Take care.